Community Connection on KGNB, brought to you by Waters International Realty.
This is Paige Green with your Community Connection. We're here with Jim Scheele from Christus Santa Rosa Hospital. Jim, how are you?
I'm great. How are you doing this morning?
I'm great. Thank you for asking. So just let's get into it and tell me a little bit about what you do for Christus.
Sure. So I'm actually the philanthropic officer for the Friends of Christus Santa Rosa. Here at the hospital, we have a foundation that raises funds for those folks that are either underinsured or have no insurance, or we help those that may need a little help. We also help those folks that need, or we help the hospital when they need medical equipment or supplies of those natures.
So tell me a little bit about Christus in general. It serves New Braunfels. It's a full-service, nonprofit community hospital. Tell me a little bit about how that works being a nonprofit hospital.
Right. So what we do, we are not-for-profit. In other words, if people don't have insurance, we're not kicking them out. We obviously try to help them out. We're a 94 private bed facility that brings a legacy of more than 60 years of proven health care to New Braunfels and Canal County. And we continue to expand the needs of the community. Obviously, it's growing. And I think a lot of people like this as their hometown hospital. In fact, we were voted the best hospital 2 years in a row, so we hope we continue to do that. You mentioned that we are a not-for-profit hospital. Because we're not-profit, we seek support from different community organizations such as the United Way. And we also do, as I work, for the Friends of Christus Santa Rosa Foundation. So let me tell you a little bit about the foundation. We were founded in 97, and as I said, we raised funds for hospital to support programs, equipment upgrades, and needs for those underinsured patients. We realize that, most people think, hey, we make a lot of money. You see your hospital bill, but we have all of those people that come in that, don't necessarily have insurance. And so we want to help those individuals and not turn those individuals away. And so we raise funds to help that.
How can people donate to or help the Friends Foundation for Christus and make sure, you're getting the support and funding needed?
No, absolutely. One way is you can actually go to our website. It's www.friendsfoundation.org, and that's our Friends Foundation page. And when you do that, you want to actually restrict your funds to New Braunfels. So those funds go directly here in New Braunfels, and then we can in turn give them to the hospital.
And you said specifically New Braunfels. Where does the Christus Santa Rosa Hospital fully serve? I know we have one in New Braunfels, but there's multiple locations. I know there is one in San Marcos, I believe, as well.
No, you're correct. Christus Health oversees a lot of different hospitals across the United States. Christus Santa Rosa specifically oversees San Antonio. We have a Westover Hills Hospital, an Alamo Heights, and a medical center. We also have the Children's Hospital, then, of course, New Braunfels and San Marcos.
Do you have to be a New Braunfels resident to visit San Marcos, the New Braunfels resident to visit the Christus Santa Rosa Hospital, or do you serve greater than New Braunfels?
No, we have people coming all over. You see a lot of people that come down during the winter, and they may be from Nebraska or Ohio or Michigan, and they utilize the hospital. The same token, you may have people coming from Corpus, Houston, South Texas, and a lot of different people utilize the hospital. So depending what their needs are, where they are, what their purpose is at that time, or the emergency that may pop up.
And can you just tell me a little bit more about the relation of Friends Foundation of Christus and the Christus Santa Rosa Hospital, how that relationship works in regards to the community and funding?
Yeah, no, absolutely. We were founded in 1997, and what we do with the Friends Foundation, we raise funds for the hospital. The foundation itself oversees, as I said, the adult hospitals at Westover Hills, Alamo Heights, the medical center, New Braunfels, and San Marcos. But what I do specifically is utilize funds that we raise specifically for this hospital in New Braunfels. And what's important to me, I live here, I was raised here, I want the funds to stay here in New Braunfels.
And I know right now y'all have one of your urgent needs is women's health. I know kind of you want to talk about that and some of the missions you have right now regarding women's health.
Absolutely. Jennifer Rucker, our president here at the hospital, stated that women's health is one of the most important identified urgent needs. And within women's health, one of the things that we've created is a mission. It's called the Every Baby Matters mission. We started that many years ago. It's a great mission. We raise funds for that specific project. And, one of the things that is unique is that it's only available here in New Braunfels. It's not anywhere outside of New Braunfels, not anywhere in the state or United States. And we're very blessed to have that program.
Before we turn it over to Anna Akin about the Women's Health and Every Baby Matters mission, do you have any upcoming events through the Friends Foundation or anything that community can be on the lookout for?
Yeah, the next event that we'll have is not until October, but it's called our National Speakers Lunch, and I'll be happy to pass some information on to that. Every year we have a noted speaker that comes out, and then we also give an award. It's called a Beacon Award. We typically do it at the Whitty Museum in San Antonio. It's one of our largest fundraisers that we have, and we raise funds for that, and then those funds again are dispersed throughout the Christus Santa Rosa Adult Hospital system.
And that event was in October. Where can you find that information? Is this also on the Friends Foundation website?
Absolutely, or they can contact me here at the hospital.
Thank you, Jim. We're going to turn it over to Anna Akin to talk about the Birthing Center and Every Baby Matters mission that we just mentioned. Anna, how are you?
I'm doing well. How are you?
I'm great. Thank you again for asking. So tell me a little bit about the Every Baby Matters mission at the hospital.
The Every Baby Matters mission is a program that we offer through the Birthing Center here at Christus Santa Rosa, New Braunfels. The Birthing Center offers a complete obstetric program to guide women through pregnancy, labor and delivery, and the postpartum period. We also have a level 2 NICU here that's formally affiliated with the Children's Hospital of San Antonio. The Every Baby Matters mission specifically is a free home visit program offered to all mothers whose babies are born at Christus Santa Rosa, New Braunfels. Participating families are visited at their homes by a registered nurse who completes a medical assessment on mom and baby and assesses the need for additional education. It provides the opportunity to step into the home and address issues that are less likely to be revealed while in the hospital or at a doctor's office.
So you have a full staff on call 24/7 to care for moms and infants. What can they expect through this mission and this program when needing this care?
At the Birthing Center, we have a staff of OB-GYN physicians, neonatal specialists, and maternal fetal medicine physicians on call 24 hours a day, 7 days a week. Our home visit nurse, Tana, visits these families after discharge, and she helps to connect them. If she identifies any needs or issues after discharge, she helps to connect them back with their doctors or with pediatric specialists or community resources, or she will refer them back to our lactation consultant, Shauna Baker.
How many people have you served through this mission?
Last year we had 436 babies born here, and we were able to see 850 unduplicated clients in their homes throughout the New Braunfels community.
And is there anything like this in the area, this similar to the Every Babies Matter mission, or how specific is this to Christus Santa Rosa in New Braunfels?
This is something that only Christus Santa Rosa New Braunfels offers in our community and the greater San Antonio area. It is a program that is unique to our facility and that is completely free for the patients because it is funded through donated money.
What are some of the goals of this Every Baby Matters mission? Why was it started or originated from?
I think that the Every Baby Matters mission was started several years ago when healthcare workers recognized the need for families to be seen prior to their 6-week visit postpartum. Some of the goals of this program include reducing maternal morbidity and mortality, preventing hospital readmissions, identifying child abuse or neglect, and providing early intervention and education for families in Comal County. It's important to understand that 50% of the maternal deaths in Texas last year were in the postpartum period, and infant deaths related to unsafe sleep are on the rise in the greater San Antonio area. So the main goal of this program is to bridge the gap between the standard 6-week postpartum visit with the doctor and address medical and emotional risks in mom and baby and link families with community resources.
And you mentioned this earlier as well, but can you kind of go back over how this program will and wants to reach these goals of understanding that maternal deaths are in the postpartum period and how you want to use these goals to kind of address this issue, in women's health?
Well, there are a number of complications that can occur after discharge that maybe weren't present while a patient was here in the hospital, and they maybe didn't have good understanding of signs and symptoms of things to look for. We offer a ton of education while moms are here in the hospital, but we also recognize that they've been in labor, they're tired. It's not the best learning time for a new mom, and then a lot of questions come up after discharge. So our goal is for a mom to be seen within 2 weeks of discharge to sometimes it's just to offer reassurance, to let them know they're doing a great job and check everything out. But sometimes we find things that maybe a cardiac defect that wasn't there while they were here in the hospital, but now has an audible murmur. We can connect them back with their pediatrician or with the cardiologist. There are sometimes blood pressure complications with mom that can arise that even when her blood pressure was fine during labor and delivery, it can be elevated after delivery. So our home visit nurse just assesses every mom and baby and tries to identify. She sees every mom and baby to look for medical and social issues.
And who can use this program?
Who can use the program? The home visit is currently offered to all families, no matter their identified healthcare risks. We recognize that some complications or questions don't arise till after discharge, and every visit looks different depending on the needs of the family.
What are some of the common medical issues addressed during these home visits or through this program?
Issues that are typically addressed for an infant include feeding difficulties, jaundice, cardiac defects, safe sleep and crib safety, along with an assessment for signs of abuse or neglect. Common maternal complications can include high blood pressure, abnormal bleeding, various types of infections, postpartum depression, substance abuse, or difficulties just meeting the needs of their family.
During specifically these home visits, is there anything that the patient needs to do specifically?
No. Our home visit nurse, Tana Bonner, is typically the one that does them, but she does have a couple of helpers that help out, and she'll contact the families and set up an appointment at a time that's convenient for them. She sometimes sees babies in the evenings or the weekends or whenever it's convenient for the family. She likes for them to have other family members present if possible, if they have any questions. She tries to block a good amount of time just in case she gets there and people are requiring more help than what she anticipated. She's a very great listener, and sometimes, they focus on one issue, sometimes they cover several. It just depends what the family's needs are.
And how can people use this program through Christus Santa Rosa?
There is nothing that a patient needs to do. Tana comes to the hospital. Sometimes she makes the appointment with the patient prior to their discharge, but she gets the demographic information for every patient that delivers here and makes an effort to contact them. Not everyone takes her up on the home visit, but she, especially during COVID, she has had great response to people being open to this type of help.
And what is some of the patient feedback you've received?
We recently got a really sweet letter from a patient that I'd like to share with you. She said, "I really appreciated the home visit. It's courteous that the hospital checks in on new mothers to make sure they have what they need and feel comfortable at home. My pediatrician asked me to begin supplementing because my baby wasn't gaining weight fast enough. It was a big stressor for me as I was already struggling with my confidence in breastfeeding. It was nice to have a nurse come out to the comfort of my home. She checked on me and made sure I was feeling healthy, and then she checked the baby. She answered all of my questions and reassured me that I was doing a great job. This program is great, especially for first-time moms. We leave the hospital knowing some things, the things we learned in baby prep classes, the nurses while in the hospital, and baby books. But it's a whole new ballgame actually experiencing parenthood. It's great that this program exists to ease the hearts and minds of all the moms out there. Struggling or not, it's still nice to have another person around to ask questions to and have support from."
That is a wonderful letter to receive. I'm sure that was just wonderful to read and know you are making a difference in mothers and infants' lives and the information they need and the care they need.
Yes, ma'am. It is a very rewarding program.
Is there anything else you would like to add about the Every Baby Matters mission or Christus Santa Rosa before we wrap it up and tell people how they can find about any more information?
Hey, one of the things I did want to mention, and I think it's absolutely incredible, with Tana goes out and visits with these new moms, and I can tell you, when I was a new dad, in my case, the first time you have a child and maybe you're unsure about what to do or unsure how to do it, and it's comforting to know that you have a nurse that will go out and visit and talk to you and comfort you and maybe reassure you on some of those things. And coupled with that, one of the nice things is, the moms have the babies, and maybe, the first-time moms, they're afraid to maybe take the baby back to the hospital, thinking, well, I don't want them to, catch anything. And so, again, it's a plus for Tana to go out and actually visit with those moms and share her experiences and talk to them and to comfort them. And so that's one of the neat things I really like about this program.
And how can people support this program specifically? I know you can go to United Way or directly to the Friends of Christus Foundation website.
Absolutely. So there's a number of ways. As we mentioned before, you can go to the Friends Foundation website and donate. The other thing is you can give to the United Way. The United Way has been a big supporter of this program over the years and has supported this program. In addition, I also want to mention the GVTC Foundation, Guadalupe Valley Telephone Cooperative Foundation. They've supported us with grants for this money as well. So there's a number of organizations that have supported this organization. I would suggest you go out and help support them as well.
Is there anything else you both would like to add about Christus Santa Rosa or the Every Baby Matters mission?
We think it's a great program. We continue to strive in satisfaction for those moms and individuals that come to Christus Santa Rosa. We want you to feel that it's a community hospital, and we're here for you.
Thank you both for speaking with us today about Christus Santa Rosa and the Every Baby Matters mission. We really appreciate everything you are all doing for mothers and families in New Braunfels.